In these next two video lessons, we're going to talk about gastric ulcers. So we're going to carry on this discussion with nutrition-related diseases. Now, before we get going, we need to remind ourselves of digestive anatomy. Go back to module 1. When we talked about the stomach of the horse, we talked about the two regions. So there's this upper squamous region that is not protected against the highly acidic stomach acid. And then this lower portion, glandular region, that is. Now, in this video lesson, we're going to talk about the squamous region. And then in the next one, we'll discuss the glandular region because both can get ulcers. Now, what happens in these ulcers is this acid will burn through the stomach lining that leads to discomfort and pain in the horse. Now, when we look at the population of horses that are suffering from gastric ulcers, here you can look at some data and you see it's our performance horses. It's our thoroughbreds at the racetrack. They are the ones that tend to develop more ulcers in both regions. Now, our leisure horses, about 11% of the population has gastric ulcers, and that's because they probably don't have as much stress in their life. They're not traveling as much, competing as much, heavy exercise, all of these things that can lead to ulcer formation. Now, when we look at the signs of gastric ulcers, this is not an exhaustive list, but a list of some signs that you could look for. And again, some of these can be linked to other disorders. So they're not directly linked to gastric ulcers, but horses that are suffering from gastric ulcers may show some of these signs like girthiness, poor coats because they're not eating, or like I said, picky eaters. They have stereotypies. They're nervous. Weight loss, all of these things could be signs that your horse is suffering from gastric ulcers. If you suspect gastric ulcers, always talk to your veterinarian about it because they're the ones that can diagnose and treat. So if you suspect your horse has gastric ulcers, always keep in mind the severity of signs does not always correlate with the severity of ulcers. It's going to take your veterinarian doing an endoscopy to look into the stomach and look for ulcers. Now, again, that could be expensive and that may not be available in your area, so speak to your veterinarian. Also keep in mind, different horses, they have different personalities and they may tolerate pain more than their neighbor. So some horses that don't have very much ulcers or any ulcers at all may show some signs, where a horse that's suffering from severe ulcers may never show signs. So just always keep that in mind when you're looking at this. Now let's talk about squamous ulcers. What are some of the causes and what are things we can do to mitigate the chances of horses getting them, or how can we help them heal if they have them? Now again, the overall cause is increased exposure to acid. So again, this upper region of the stomach does not have protection. And because we've domesticated these horses, how we manage them, and then we put them in these performance and training schedules, that is why we're seeing high incidence of ulcers, again, in those performance horses. So one thing is with exercise. When horses exercise, especially on an empty stomach, it pushes that acid up into that upper region of the stomach. So that squamous region, that acid splashing can lead to ulceration. So one thing you could do is feed forage or a forage-based pellet before exercise, and it helps keep food in the stomach and reduces the splashing of the acid in the upper regions of the stomach. Now, when it comes to feeding grain or concentrate, remember, less saliva is produced. They're not spending as much time masticating, so they're not producing as much saliva, which is not neutralizing that stomach acid, say, versus forage. So there's some things we have to think about with that. And also microbes in the stomach will break down starch and produce volatile fatty acids, which can harm the squamous cells in the upper portion of the stomach. So when it comes to grain feeding, we also meal feed, and typically twice per day, because we have busy lives and many owners don't have the time to go feed their horses at an optimal 4 times a day or even 3 times a day. So when we have empty stomachs and we have continuous acid production, it increases that exposure to that squamous region. So some tips we could do is limit the sweet feeds. So we're not getting as much starch, VFAs in the stomach from those microbes. We want to limit our starch to 1 gram per kilogram of body weight. So if we use that 500 kilogram, 1,100 pound horse example, that would be 500 grams. Or if you convert that to pounds, it's about 1.1 pounds of starch per meal. Feed grain no more than 6 hours apart, because that long overnight fast or during the day can lead to this. And also you want to feed your grain after you ensure your horse has been eating forage. So if you're feeding hay in a concentrate or hay in grain, make sure they eat their hay first, then feed them the grain. Another confounding factor that leads to ulcers is water restriction. Now, you should make sure your horses have access to fresh, clean water 24/7. But sometimes training competitions, horses may not have access to water, and that could lead to ulcer formation. Or sometimes the stress of not having access to water can lead to ulcer formation in your horses. So we want to ensure our horses have continual access to water 24/7. And then we want our electrolytes added to that water. So we ensure they're drinking. And then also the paste is not ideal, especially when it comes to ulcers. So we tend to recommend you avoid that. Then the next factor is stress. And think about the performance horse, what we ask of them, and how they're continuing this training and trailering and going to shows. And we know when horses are stressed, that could lead to ulcer formation and even slow down healing. So this is going to depend on your individual horse and your individual operation. But think about the frequency of travel, the competition schedules, the exercise and training schedules, changing environments, confining them to stalls, introducing them to new horses, all of these factors. And when we're trying to limit ulcer formation or stimulate healing, we need to reduce stress. And that is going to depend on the individual horse and their situation. But if we can reduce stress, that will limit ulcer formation and also promote healing. So in the next video lesson, we're going to talk about glandular ulcers and then nutritional support for optimal gastric health. So look for that.